Assalamu alaikum. My name is Maria Abdurrahman, roll number BP1650121, group number 15 from the 4th Prof. My topic is the essential hypertension and the subtopic is how the calcium channel blockers can treat or manage this condition. Hypertension. First we have to discuss that what is the hypertension. It is defined as the sustained increase in the systemic blood pressure, either systolic or diastolic. Resting systolic blood pressure is greater than 140 mm Hg and diastolic blood pressure is greater than 90 mm Hg. That means that if there is a continuous increase in the blood pressure, even in the resting conditions, then it is said to be the hypertension. Means as normal blood pressure is 120 per 80, but if you have greater than 140 per 90 millimeter Hg, then it will indicate that you have hypertension. Types of the hypertension. Usually we discuss the four types of the hypertension. The first one is the essential hypertension. This is the type of the hypertension without any identifiable cause. Usually 90 to 95% of the population have this type of the hypertension in which the cause is not known. The second one is the secondary hypertension, and this type is due to the specific reasons that may be the drug induced hypertension or there are some pathophysiological conditions which leads to this hypertension. The third one is the pseudo hypertension. It is also known as the false hypertension and it is commonly occurs in the elderly patients because in old age patients their blood vessels are usually constricted, so the blood pressure is the normal blood pressure is usually higher than the young ones. The fourth one is the white coat hypertension, and this type of the hypertension is that in which the blood pressure is increased in the clinical or the hospital environment. But as the person comes out from this environment, his blood pressure gets normal. So this type is known as the white coat hypertension. Now, the risk factors of the essential hypertension. There are some factors which can cause the essential hypertension. Number one is the diet, stress, minimum physical activity, overweight, and genetic inheritance. If these factors are not controlled or not managed, then they can increase the risk of the essential hypertension. And if the essential hypertension is not properly treated or managed, then it will lead to the severe complications, which includes the coronary artery disease, includes the myocardial infarction and the angina, stroke, congestive heart failure, peripheral vascular diseases, or the persistent kidney injury. The development of the hypertension, how this condition is developed. In the normal condition, the blood pressure is directly proportional to the product of the blood flow, that is the cardiac output and the peripheral vascular resistance. Means if the cardiac output or the peripheral vascular resistance is increased, then this will cause increase in the blood pressure. So there are two main reasons to explain that how the hypertension develops. The number one is the alteration in the conductile properties of the smooth muscles in arterial walls. And the second one is the failure of the response to normal autoregulatory mechanism. Means if there is any alteration in the contraction of the muscles or the normal mechanism which is responsible to regulate the blood pressure is failed, then this will cause to increase the blood pressure. The pharmacotherapy of the essential hypertension. There are certain agents which are used to treat the hypertension and they are classified as the first line agents, second line agents and the other or the third line agents. The first line agents include the angiotensin converting enzyme inhibitors, angiotensin receptor blockers, calcium channel blockers, and the thiazide diuretics. Second line includes the beta blockers, aldosterone antagonist. The third one includes the loop diuretics, alpha blockers, vasodilators, and the adrenergic antagonist. Calcium channel blockers CCBs. The contraction of the vascular smooth muscles and the myocardial cell mainly depends on the entry of calcium into the cell. Calcium when enters in the smooth muscles, it forms a complex with a protein calmodulin. This calcium calmodulin complex that activates the enzyme myosin light chain kinase. The activated enzyme responsible for the phosphorylation of the myosin light chain, and after this phosphorylation, the interaction of the myosin with the actin is usually starts, and this will lead to the contraction. So when calcium enters in the cells, it actually performed a contraction in this way. So if we block the entry of the calcium into the cells by using the calcium channel blockers, because they can block the calcium channels through which the calcium enters into the cells. So if these channels are blocked, the calcium is no longer able to enter into the cell into the smooth muscles and the myocardium. So this will reduce the number of the free calcium ions in the vascular smooth muscles and the myocardial cells. And as the free calcium ions are decreased, so the contraction process is also blocked. And when contraction blocked, this will lead to the allow the vessels to relax and open. And as the vessels are open, relaxed, so the blood pressure and the peripheral vascular resistance is decreased. This will, in this way, the calcium channel blocker actually reduces the blood pressure. Now, the case study. AP is a 71-year-old man with a blood pressure of 168 per 90 mm Hg and 170 per 90 mm Hg when repeated, and a heart rate of 88 beats per minute. He has a history of a chronic stable angina that is controlled with the sublingual nitroglycerin as needed. He also has a severe asthma that is worsened with the beta blocker therapy. He currently has no chest pain and his ECG shows no acute ischemia. Other laboratory results are within normal range, except his serum creatinine is 1.3 milligram per deciliter, and the normal one is zero point 0.5 to 1.2 milligram per deciliter. Is a calcium channel blocker appropriate for AP? If yes, then which type is preferred? Soap notes. Subjective. Age 71 years old. Gender male. History hypertension, chronic stable angina, and the severe asthma. Medications used are the beta blocker therapy for the hypertension and the sublingual nitroglycerin for the chronic stable angina as needed. Objective shows that the blood pressure is 168 per 90 mm Hg and when repeated it is 170 per 90 mm Hg. Heart rate 88 beats per minute. Serum creatinine level are 1.3 milligram per deciliter and the normal is zero point 0.1 to 1.2 milligram per deciliter. Other lab reports are normal. ECG shows no acute ischemia and no chest pain. Assessment. Beta blockers are given for the treatment of the hypertension, but as the patient has the chronic coronary artery disease, that is the chronic stable angina, and the severe asthma, that's why they are not so effective. Due to the adverse effects of the beta blocker therapy, the hypertensive medication needs to be changed. Asthma gets worse when take the beta blockers because they cause the bronchoconstriction and the serum creatinine levels are a little bit high because Venous plasma flow is usually decreased due to a decreased cardiac output, which is caused by the beta blockers. So, as the cardiac output is decreased, venous plasma flow is decreased, GFR is also decreased, and this will cause the serum creatinine levels high. Plan. The calcium channel blockers is appropriate for the patient because the beta blocker worsens his severe asthma. As our patient is previously on the beta blocker therapy, but he is also the patient of the asthma, and the beta blockers are worsening his conditions. That is why we are giving him the calcium channel blockers because they are compellingly indicated in the hypertension with the chronic coronary artery disease as alternative to beta blockers. Means if the beta blockers are causing any adverse effect or any complexity, then we have to replace this beta blocker therapy with the calcium channel blockers because the patient has the coronary artery disease, that is the chronic stable angina, and the calcium channel blockers are perfect to use when the patient have both conditions, that is the hypertension associated with the chronic CAD. That's why we preferred calcium channel blockers. And the non-dihydropyridine is preferred because it decreases the myocardial oxygen demand, improves the myocardial blood flow, causes vasodilation, and have negative inotropic effect. The other type is also, which is known as the dihydropyridine, and it is not preferred here because it does not decrease myocardial oxygen demand that much and not produces the effects as compared to the non-dihydropyridine. So that is why we preferred it. Now the verapamil is a drug of choice which lowers his elevated heart rate and the blood pressure, treats angina, and improves kidney functions. Verapamil also prevents the bronchoconstriction and induces the bronchodilation, hence can be given to asthma patients. So, our patient's condition is managed by this drug because he has severe asthma and by the calcium channel blockers there is no any bronchoconstriction. So this condition is managed and also it can control the heart rate and blood pressure plus treats the angina. So no need to give the trinitroglycerine. So that is why, and also it improves the kidney functions, which due to which the serum creatinine levels again get back to normal. That is why we prefer this drug. Dosing. A low dose of 120 to 180 milligrams should be used initially and slowly titrated at 2 to 4 weeks of intervals. Side effects. It can cause constipation, usually in elderly patients, but it can be encountered with the dietary changes or the bulk forming laxative. And as our patient is also 71 years old, that means he is elderly patient. So this drug may cause the side effect of the constipation in him. That is why we have to give him the bulk forming laxative or to make him sure that he can change his diet. So used the laxative in or the dietary fiber diet in his diet. Drug-drug interactions. Verapamil, when taken with digoxin, it increases its level, which leads to the digoxin toxicity. So administer with caution. And when it can increase the level of the cimetidine. So adjust the dose of the cimetidine when given with verapamil. So when we have to give this drug with the other drugs, we have to give it very cautiously because it can cause a toxicity or can increase their concentrations. So administered with great care and adjust the doses. Thank you.